Okay, so you know how it is like you want all the info, but you don't have time to wade through a ton of research.
Right.
Just want someone to sort of break it all down and give you those key insights.
Yeah.
Well, that's what we do here at the Deep Dive.
Mm.
We're all about taking complex topics and, pulling out the really important stuff, the stuff that helps you connect the dots.
Yeah, and we try to make it fun too, like a conversation, not just a dry lecture.
Exactly.
Sure.
And today's topic is something that affects literally everyone as we journey through life.
It is.
Our health.
Yes.
And how it evolves over time from childhood to, well, old age.
And we've got some really great research to dig into, not just biological stuff, but also psychological and social factors that influence health.
Right. So today's mission is to create this map of health across the lifespan.
I like that, a map.
Yeah, to highlight those key things we learn along the way about how our bodies and minds change, and hopefully point out some surprising stuff too.
Right. And because you're someone who wants to really get it fast, we're going to distill everything down to the essentials.
Exactly. So we've got 4 main areas we'll be exploring based on the sources.
Okay.
Health, illness, and disease, nutrition and eating behavior, exercise, and substance use.
Okay, sounds good.
All right, let's dive in.
Let's do it.
Starting with the big picture, health, illness, and disease across the lifespan. And I think it makes sense to begin at the beginning with children's health.
Okay.
And something that really jumps out to me is the power of prevention.
Yeah.
It seems obvious, but when you see a visual like the immunization schedule, it's a reminder of how much we can do early on to protect them.
And that's really important, and not just for the individual child, but also for the whole community. That idea of herd immunity. When enough people are vaccinated, it helps to protect those who can't be vaccinated for whatever reason.
Right.
And then there's preventing accidents, which becomes super important as kids develop their motor skills and, become more curious about the world.
Right. And the research really gets specific about common accidents in infancy, like aspiration, suffocation, falls, things you might not always think about.
It's a lot.
Yeah, and it makes sense that healthcare for children has to be tailored to their developmental stage.
Absolutely. Like car seat safety, for instance.
Yeah, their bodies are so different.
Completely. And they don't understand danger in the same way that adults do.
No, they don't.
So caregivers play a huge role in keeping them safe.
Yeah, and the studies really emphasize that. For example, parental smoking.
Yeah, that's a big one.
There was a study, the Pagani study, that found a link between exposure to secondhand smoke and things like wheezing and asthma in children.
Oh, wow.
And even later on, problems with behavior like antisocial behavior. It's incredible to think that something in the air they breathe can have such a long-lasting effect.
It really is. And then when you add poverty into the mix, the challenges become even more significant.
Absolutely. The numbers are pretty sobering, like the percentage of kids in the U.S. who don't have regular access to a doctor, or the millions of preschoolers who are malnourished and more vulnerable to getting sick because their immune systems are weaker.
Right. And globally, the under 5 mortality rate is a really powerful indicator of a country's well-being.
Yeah.
And UNICEF reports point to things like maternal health, nutrition, vaccination rates, sanitation, and access to healthcare as major factors. Poverty creates the cycle where kids are more likely to be hungry, sick, and without access to basic medical care. And the increase in deaths from HIV/AIDS in young children in high poverty areas is just devastating.
Absolutely. So moving into adolescence.
Okay.
Something that really struck me is how critical this period is for establishing lifelong health habits.
That makes sense. The teenage years.
Yeah, the choices they make now can have long-term consequences down the road.
Right. And the influences on those choices are changing. Family is still important, of course, but now you've got friends, schools, and neighborhoods all exerting their own pressures and providing different examples of how to behave.
Right. And the studies show that those family connections are still so important.
Yeah.
There was this study, the National Longitudinal Study of Health, that found that teens who eat dinner with their parents more often are less likely to engage in risky behaviors.
That's interesting.
And another one, the Kim study, found that when parents are caring and involved, their kids tend to eat healthier and maintain a healthier weight.
That's great. But then there's peer influence.
Right, which can be so powerful in adolescence.
It is.
That need to fit in to not seem different.
Yeah.
It can lead to a lot of risky choices.
Yeah.
Smoking, drug use, early sexual activity. And there's research that shows how a friend's behavior can directly increase the chances of a teenager engaging in those activities.
Like that Solosky study where they found that
Right, exactly.
friends' alcohol use increased the likelihood of a teenager binge drinking.
Exactly. So there's all these external factors, but the research really emphasizes that Ultimately, it's the teenager's own choices that determine their health outcomes.
That's a good point.
It's about recognizing those influences and making informed decisions about their well-being.
Yeah, it is.
Now, shifting to emerging in young adulthood, there's this surprising statistic that the death rate more than doubles compared to adolescents.
Wow.
And young men are a big part of that increase.
Yeah, that's not something you'd expect.
Not at all. And what's interesting is that young adults often know what's healthy,
Yeah,
but there's this disconnect between knowing and doing.
right.
The sources point to things like increased independence, less parental oversight, and the pressures of school or work as contributing to these higher rates of risky behaviors, chronic health problems, obesity, and even mental health disorders.
Right.
Like the Hill study found that
Yeah.
it's easy to see how those late-night study sessions, fueled by junk food and too much caffeine, can catch up with you.
It's true.
But the research highlights these unhealthy patterns. Skipping breakfast, relying on snacks, eating, or drinking to excess, not getting enough exercise or sleep, and they have real consequences.
Yeah, and the studies show that.
Right.
Yeah.
Like the Nicoteri and Miskowski study found an increase in the number of overweight and obese college seniors.
That's concerning.
And the Berkeley longitudinal study found a link between physical health at age 30 and life satisfaction at age 70.
Wow. So those choices early on,
Right. They can have long-term consequences.
they can.
All right, so we've talked about childhood and young adulthood now. Let's move into health and aging. And it's easy to assume that as we age, our health inevitably declines. But the research paints a more nuanced picture.
It does.
Many older adults are actually quite healthy.
That's good to hear.
Yeah, one statistic that stood out is that only 17% of people between 65 and 74 have a disability.
That's encouraging.
It is. But it's also important to understand the nature of chronic disorders.
Right, those health issues that develop slowly and last for a long time.
Exactly. And they do become more common as we age.
They do.
And the research lists the most common chronic disorders in middle age for men and women, things like arthritis, high blood pressure, sinus problems, hearing loss, heart disease. And it's interesting to see how those vary between the sexes.
It is.
Like, for example, women are more likely to experience non-fatal chronic conditions, while men are more likely to have fatal ones.
Interesting.
And then there's the question of what are the leading causes of death in older adults?
Right.
And it turns out that's shifted over time.
It has.
Cancer has overtaken cardiovascular disease as the leading cause of death for people between 65 and 74.
Oh, wow.
But for those over 75, cardiovascular disease is still the top cause.
Okay, so it depends on the age group.
Right. And the research points to improvements in medications, lower smoking rates, better diets, and increased exercise as factors in reducing deaths from heart disease.
That's good news.
It is. But there are certain chronic conditions that are more likely to limit people's ability to work.
Right.
Heart conditions, diabetes, asthma, and arthritis.
So things that affect mobility and overall well-being.
Exactly.
Yeah.
And arthritis, which is inflammation of the joints, is the most common chronic condition in older adults.
It is.
It causes pain, stiffness,
Yeah.
and it can really impact quality of life.
Yeah, and there's no cure, but there are treatments that can help manage the symptoms and improve mobility.
Right. Things like medications, exercise, and even joint replacement surgery.
That's good.
And then there's osteoporosis, which is a significant loss of bone density.
Right.
It can cause older people to become hunched over, and it's more common in women.
Yeah, and the risk factors are things like not getting enough calcium or vitamin D, not enough estrogen, and lack of exercise.
Right. So those healthy habits we talked about earlier really do pay off in the long run.
It seems so.
Now let's delve into a major health concern in aging Alzheimer's disease.
Okay.
And the research gives us a really thorough look at this.
Good.
So Alzheimer's is a progressive brain disorder.
Meaning it gets worse over time.
Right. And it's irreversible.
There's no cure.
Not yet, unfortunately. It's a form of dementia that affects memory, thinking, language, and eventually even basic physical functions.
It's a tough one.
And the numbers are really concerning. Millions of people in the U.S. alone are affected. And with the aging population, those numbers are projected to rise significantly.
Wow.
And the cost of care is just enormous.
Yeah, it's a huge burden.
So what's happening in the brain is there's this deficiency in a neurotransmitter called acetylcholine,
Acetylcholine.
which is essential for communication between brain cells. And then there's the physical damage to the brain.
Right. With the formation of these amyloid plaques and neurofibrillary tangles made of tau protein.
Exactly. And the research also points to the role of oxidative stress and something called the free radical theory, which we've touched on before.
So it connects to those broader ideas about how we age.
Right. Now, when it comes to the risk of developing Alzheimer's, there are several factors at play.
Okay.
Age is a big one,
Makes sense.
and genes definitely play a role.
Yeah, there's this gene called ApoE, and specifically a variant called ApoE4. Right. Which is a significant risk factor, although not everyone with that gene variant develops Alzheimer's. It just increases the likelihood.
Right. And there are other genes that have been linked to early onset Alzheimer's.
So it's a complex genetic picture.
It is. But the research also emphasizes that it's not just about your genes.
Right.
Lifestyle choices also seem to play a crucial role through something called epigenetics.
Oh, interesting. So like those switches that can turn genes on or off.
Exactly. And those switches can be flipped by things like what we eat, how much we exercise, even our environment.
Wow, so our genes aren't our destiny.
Right. Having certain genes might increase your risk, but it doesn't mean it's inevitable.
That's good to know.
And the research highlights the connection between heart health and brain health.
Okay.
Those risk factors for cardiovascular disease like obesity, smoking high cholesterol, they also seem to increase the risk for Alzheimer's.
So what's good for the heart is good for the brain.
Exactly. Now, there's this thing called mild cognitive impairment, or MCI,
MCI.
which is being recognized as a kind of transitional phase.
So like a warning sign.
Right, a risk factor for developing Alzheimer's.
Okay.
The tricky thing is that it can be hard to distinguish between MCI and the normal age-related changes in memory.
I can see how that would be challenging.
Yeah, but there's research showing that people with MCI who also have that ApoE4 gene variant are more likely to develop Alzheimer's.
Oh, wow.
And the severity of their memory problems seems to be linked to how quickly their condition worsens.
That makes sense.
Now, in terms of treatment, the current medications, things like Aricept, Razidine, Exelon, Namenda, Namzaric, they can help manage the symptoms.
But they don't cure the disease.
Right. They work by affecting brain chemicals,
Yeah.
but they don't address the underlying cause. And there aren't any approved drugs specifically for MCI yet.
So more research is needed.
Absolutely.
Yeah.
Now, another really important aspect is the burden of caregiving for people with Alzheimer's.
Yeah, that's a big one.
The research shows that family caregivers experience tremendous stress, often even more so than caregivers for people with other serious illnesses like cancer.
That's a lot.
And respite care, which provides temporary relief for caregivers, is highlighted as essential.
Yeah, it's so important for caregivers to take care of themselves, too.
Absolutely. And there's this study, the Velamaki study, that found a decline in quality of life for Alzheimer's caregivers.
That's heartbreaking.
It is, and it really underscores the emotional and physical toll that caregiving takes.
It does. And there's this fascinating study by Kiekult Glaser.
Oh, yeah, and the Connecting with Research section.
Yes, that showed how the chronic stress of caregiving can actually accelerate the aging of the immune system.
Right. It's incredible how connected our minds and bodies really are.
It is. And that study found increased levels of a marker of inflammation called IL-6 in Alzheimer's caregivers.
Right. So stress has a very real biological impact.
It does. Now, the research also mentions another type of dementia, Parkinson's disease, which is a chronic and progressive condition. It's characterized by these motor symptoms like tremors, slowed movement, facial paralysis.
Right.
And it's caused by the degeneration of neurons in the brain that produce dopamine.
Dopamine.
Okay. And there are treatments available like dopamine agonists and a medication called L-Dopa, but they have limitations. And there's also a surgical procedure called deep brain stimulation, which can help, but the benefits tend to decline over time.
So it's not a perfect solution.
No, not yet. But there's ongoing research into new treatments like stem cell transplantation and gene therapy, which hold promise for the future.
It's good to know that there's hope.
It is. And another really important theme that emerges from the research is the role of stress in disease.
Right.
There's this growing recognition that stress is a major factor in many different health problems.
Yeah, it's not just about feeling stressed. It's about the cumulative effect of chronic stress on our bodies.
Exactly. And there's research to support that. Like the Carla Mangla study found that allostatic load, which is like the wear and tear on the body from chronic stress, can affect memory and thinking skills.
Wow.
And the Kolmala study found a link between stress in middle age and mobility issues later in life.
So it's really about long-term stress.
It is. And there's this researcher, Margie Lockman, who has done a lot of work on the importance of perceived control in managing stress and potentially delaying or reducing the risk of disease.
So feeling like you have some control over your life.
Exactly. That seems to be a powerful protective factor.
And the research actually lists a whole bunch of long-term stressors that are linked to a weakened immune system. Well, things like worrying about nuclear reactors, relationship problems, depression, caregiving.
Wow, that's a lot.
It is. And there's even this study, the Kim Fuchs study, that found that stress can accelerate the development of pancreatic cancer.
Wow.
But there's also good news.
Okay.
Stress-reducing activities like yoga have been shown to have a positive impact.
That's good to know.
And there's a lot of research now on how our individual reactions to stressful situations can also affect our health.
Right. So it's not just the stress itself, but how we cope with it.
Exactly. Okay, so finally, let's talk about health treatment for older adults.
Okay.
And there's this clear trend towards more care being provided at home and in the community.
Which is great.
It is. But the reality is that the likelihood of needing to go into a nursing home still increases with age.
Right.
And the research highlights some concerns about the quality of care in nursing homes. Things like deficiencies in meeting standards and protecting residents' rights.
So it's important to explore alternatives.
Absolutely.
Yeah.
Things like home health care, adult daycare centers,
Yeah.
preventive health clinics,
Right.
which can often be less expensive and less impersonal.
And there's a growing need for home care workers.
Yeah.
And there was a study, the NICMAT study,
Uh-huh.
that found better outcomes for people with cognitive impairment when they're cared for at home.
That's good to know.
And then there's this classic study by Redun and Langer that looked at the impact of giving nursing home residents more control over their daily lives.
Oh, yeah.
They found that the residents who had more responsibility and autonomy
Right.
actually showed improvements in alertness, activity levels, happiness, and even their physical health.
Wow.
And they had a lower death rate.
It's incredible how even small choices can have such a big impact.
It is.
Okay, so we've covered a lot about health, illness, and disease across the lifespan. Now let's shift gears and talk about another essential aspect of health nutrition
Okay.
and how our eating habits change as we grow and develop.
Sounds good.
So starting with infancy, the research really emphasizes the importance of getting enough energy and nutrients in those early years.
Right. It's a period of incredibly rapid growth.
Yeah, babies typically triple their weight and increase their length by 50% in the first year alone.
Wow.
It's a lot.
It is.
And the caregiver plays a crucial role in shaping those early eating patterns.
Right. Providing those nutrients in a loving and supportive environment.
Exactly. And the research points to things like insensitivity, neglect, and poverty as significant risk factors.
Those are serious issues.
They are. And there's research to show the long-term impact of those early experiences.
Like?
The Kale study found that low maternal sensitivity is linked to a higher risk of obesity later on in childhood.
Oh, wow.
And it's not just about getting enough food, it's also about eating the right kinds of food.
Of course.
And there's this concern that a lot of young children aren't getting enough fruits and vegetables.
Right?
And research suggests that early preferences for certain foods can actually influence what they eat later in life.
So developing those healthy habits early on is key.
Exactly. And the Fletcher study actually demonstrated that.
That's interesting.
It is. Now, the question of breastfeeding versus bottle feeding always comes up.
Yeah,
But the research really points to the health benefits of breastfeeding for the baby.
it does.
And the rates of breastfeeding have been increasing since the 1970s, reflecting this growing understanding.
Yeah, and organizations like the American Academy of Pediatrics, AAP, strongly recommend breastfeeding.
Right.
It's considered the best for babies' health.
And the list of benefits is quite long. Fewer gastrointestinal and respiratory infections, lower risk of overweight, obesity, diabetes, SI days, and fewer hospitalizations.
That's quite a list.
And there are even benefits for the mother.
Really?
Lower risk of breast and ovarian cancer, and potentially a reduced risk of type 2 diabetes and hospitalization.
Wow, so it's really a win-win.
It seems to be. But it's important to note that the research hasn't found conclusive evidence for cognitive or cardiovascular benefits for children,
Okay.
or for things like helping the mother return to her pre-pregnancy weight, preventing bone loss, or avoiding postpartum depression.
Right. So it's not a magic bullet.
No, but overall, the evidence does point to significant health advantages for the infant.
It does.
And it's important to remember that those breastfeeding studies often show correlations.
Right. Meaning that two things happen together.
Exactly.
But it doesn't necessarily mean one causes the other.
Right. Like women who breastfeed often share other characteristics that might also contribute to those health outcomes.
Right. They tend to be wealthier, older, more educated, and more health conscious.
Exactly. So it's a complex picture.
It is.
But the overall takeaway is that breastfeeding offers those health benefits.
Right.
Okay, moving on to childhood. The research reminds us that malnutrition is still a major global problem as UNICEF data shows, and it's also a concern for low-income families here in the U.S.
It is, and food-assisted maternal and child health programs have been shown to have a positive impact.
Yeah, like those in Haiti that provide supplemental foods along with health education.
Yeah.
And here in the U.S., we have the WIC program, which provides federal grants for supplemental foods, healthcare referrals, and education.
And studies have shown that WIC has both short-term benefits for cognitive development and longer-term benefits for reading and math abilities.
Right, like the Chen and Martinez-Brockman studies.
Yeah,
Now, another major issue in childhood is overweight and obesity.
it is.
It's a serious health problem, and the statistics are really concerning. The U.S. has the second highest rate of childhood obesity globally.
Wow.
And the CDC has these BMI classifications that help us understand the scope of the problem. They define what's considered obese, overweight, and at risk.
Okay.
And what's alarming is that the percentage of young children in those categories has increased dramatically over recent decades.
So it's a growing problem.
And what's really worrying is that children who are overweight or obese are much more likely to stay that way as they grow older.
That makes sense.
And the health consequences of childhood obesity are pretty significant.
They are.
Things like breathing problems, like sleep apnea, hip problems,
Yeah.
type 2 diabetes, high blood pressure, high cholesterol, and even mental health issues like depression, anxiety, and low self-esteem.
Wow. So it affects both physical and mental health.
Exactly.
Yeah.
And the research offers some practical advice for helping overweight children. Things like involving them in decision-making, being a good role model, engaging in physical activities together, giving them healthy choices, eating healthy meals as a family, and reducing screen time.
Those are all great tips.
And when it comes to treatment, the research points to a combination of diet, exercise, and behavior modification with the important involvement of parents.
Right. So it's a multi-pronged approach.
And there are some simple guidelines, like the 5210 guidelines that can help families establish healthy habits.
Those are easy to remember.
Okay, now moving into adolescence, the research reminds us that nutrition and being overweight continue to be major issues.
Right. With those obesity rates still on the rise.
And fast food consumption is a big factor.
It is.
There was this study, the Braithwaite study, that found a link between fast food consumption and higher BMI in adolescents.
And it's not just fast food. It's also the overall intake of junk food compared to other countries.
Right. And then there's the declining consumption of fruits and vegetables.
Yeah, that's a concern.
But there are some factors that seem to protect against overweight and obesity in adolescence.
Like,
Playing on sports teams
okay, that makes sense.
and eating meals together as a family.
It's interesting.
But increased screen time is linked to higher rates of overweight and obesity.
Right. So it's about finding that balance.
Exactly. And when it comes to addressing overweight in adolescence, successful interventions seem to involve things like calorie restriction exercise, reducing sedentary behavior, and behavioral therapy.
Those are all evidence-based approaches.
Now, adolescence is also a critical period for the development of eating disorders.
Right.
And the research goes into detail about anorexia nervosa, bulimia nervosa, and binge eating disorder.
Those are serious conditions.
They are. So anorexia nervosa is characterized by this relentless pursuit of thinness through starvation.
It's a very serious and potentially life-threatening condition.
It is. And the criteria used to diagnose it are outlined in the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders. And those criteria include things like severely restricting food intake, a fear of gaining weight, a distorted body image, and a lack of recognition of the seriousness of their low weight.
So it's not just about being thin, it's about this distorted perception of their body.
Right. And there's often this obsessive thinking about food and weight and compulsive exercise.
Yeah, it can really take over their lives.
And it typically starts in early to mid-adolescence, and it's much more common in females.
And it often follows a period of dieting or a stressful event.
Right. And the research points to some interesting demographic patterns.
Right.
It's more prevalent in non-Latina, white, well-educated girls from middle or upper-income families who tend to be high-achieving and competitive.
Wow, so there's this complex interplay of factors.
Exactly. And the research suggests that things like having very high standards, feeling pressure to meet those standards, and being overly concerned about what others think can contribute to the development of anorexia.
That makes sense.
And there's also research on the role of cognitive inflexibility in perfectionistic adolescence.
So that inability to adapt their thinking.
Exactly. And there's evidence for a genetic predisposition as well.
So genes play a role.
And the research also points to how dieting can potentially alter brain function.
Oh, wow.
And then, of course, there are the cultural influences like the idealization of thinness in fashion and media.
Right. those images we're constantly bombarded with.
Now, bulimia nervosa is characterized by a cycle of binge eating and purging.
Binge eating, meaning eating a large amount of food in a short period of time.
Exactly. And purging refers to behaviors like vomiting or using laxatives to get rid of the food.
So it's about trying to prevent weight gain.
Right. And a key feature of bulimia is this feeling of lack of control during those binge eating episodes.
So it's not just about making a conscious choice to overeat?
And like anorexia, it involves preoccupation with food and weight, a fear of gaining weight, and often feelings of depression and anxiety.
Yeah, so there's a lot of overlap in terms of the psychological distress.
But unlike anorexia, people with bulimia are typically in a normal weight range.
So it can be harder to detect.
And the research suggests that maladaptive perfectionism and difficulty regulating emotions can contribute to bulimia.
So it's about those underlying psychological vulnerabilities.
And bulimia typically starts a little later in late adolescence or early adulthood, and it's also more common in women.
And the research has identified some effective treatments for bulimia, medication and psychotherapy, particularly cognitive behavior therapy.
Now, the third binge eating disorder, or BED, is characterized by recurrent episodes of binge eating, but without the compensatory behaviors like purging that we see in bulimia.
Okay, so it's just the binge eating.
Right. And there's this feeling of lack of control during the binges.
And people with BED are often overweight.
And this is a relatively new diagnosis,
Oh.
first included in the DSM in 2013.
Okay.
And like the other eating disorders, it's more common in females than males.
And the research suggests that both biological and psychological factors contribute to BED.
Right, like genes, dopamine levels, problems with self-regulation in the brain, and family functioning.
And BED is often associated with other mental health conditions like major depression and alcohol use disorder.
So it's a complex condition.
It is.
But the research has also identified some effective treatments for BD, including cognitive behavior therapy and medication.
That's good to know.
Okay, so we've covered infancy, childhood, adolescence in terms of nutrition and eating habits. Now let's move on to adulthood and aging.
Okay.
And it's clear that what we eat continues to play a crucial role in our health as we get older.
Right.
Obesity remains a serious and pervasive health problem in adulthood.
It is.
The rates are alarmingly high in the U.S., and particularly among middle-aged adults, women, and certain ethnic groups.
Yeah, and obesity is linked to a whole host of health problems.
Like an increased risk of early death, high blood pressure, diabetes, and cardiovascular disease.
Those are serious consequences.
And the research also points to a link between obesity and mental health issues like depression.
So it affects our mental well-being as well.
Now, while genes can play a role in our predisposition to gain weight, the research strongly suggests that environmental factors are largely responsible for the dramatic increase in obesity rates we've seen over the past century.
Yeah, like the increased availability of food and labor-saving devices and the decline in physical activity.
Exactly. And there are also sociocultural factors at play, like the higher prevalence of obesity among women with lower incomes and the fact that obesity rates are higher in the U.S. than in many other developed countries.
So it's a complex issue with multiple contributing factors.
Now, when it comes to losing weight, the research emphasizes that the most effective programs involve both diet and exercise.
Right. It's about making those lifestyle changes.
And there's this strong link between physical activity and maintaining weight loss.
Yeah. If you just diet without exercising, it's much harder to keep the weight off.
And studies have shown that people who are successful at losing weight and keeping it off tend to incorporate exercise meal planning and regular weighing into their routine.
So it's about developing those healthy habits that you can stick with.
Exactly. Now, there's been some interesting research on calorie restriction and longevity.
Okay.
Some animal studies have shown that drastically reducing calorie intake can increase lifespan and delay the onset of chronic diseases.
That's interesting.
But there's been debate about whether that holds true for primates.
Right.
There was this long-term study on monkeys by the National Institute of Aging that didn't find a significant increase in lifespan with calorie restriction.
Oh, wow.
But another monkey study from Wisconsin did find that calorie restriction improves survival rates.
So the evidence is mixed.
It is. And the impact of calorie restriction on human lifespan is still unclear.
It's a complex issue.
And there's also been a lot of discussion about whether taking vitamins can help us age better.
Yeah, there was this initial enthusiasm for antioxidant supplements.
Like vitamin C and E and beta-carotene.
The idea was that they could slow down aging by combating damage from free radicals.
Right. But the research on that has been inconsistent. Some studies haven't found a link between taking antioxidant supplements and a reduced risk of death or a lower chance of developing cancer or heart disease.
So those supplements might not be the magic solution they were once thought to be.
But one study did find a connection between getting antioxidants from food, not supplements, and a lower risk of Alzheimer's disease.
Okay, so it might be more about what we eat than what we take in pill form.
Right. And more recent analysis has even suggested that antioxidant supplements might not increase lifespan and could potentially increase the risk of certain diseases.
So it's not a simple answer.
No, it's not. It seems like the best approach is still to focus on eating a balanced diet.
Makes sense.
Okay, so we've talked about nutrition now. Let's move on to another.